What is the difference between physical and mental disorders?
Well, mental illness deals with the mind, which impartates with the physical body in some instances. Whereas physical illness more or less occurs where the body is maybe dysfunctional or unable to do something physically.
A physical is something that you can easily see, so people can understand it a little bit better. A mental illness is difficult for people to understand because they can't see it.
Physical is easy to improve, to get fixed, but mental you need time for that. You need to work with someone gotta talk with you. Physical is just take medicine.
Well, a mental disorder is within the brain, so you really can't see it. And a physical disorder is usually very obvious, whether it's a certain handicap, wheelchair bound, but mental disorder, for the most part, unless it's severe or not even severe, but mental retardation where you can see it physically, most mental disorders you can't really see.
A mental disorder is just something that happens within your mind, and a physical one is one that happens to your body.
Physical disorder would be, obviously, a mental is, you can't see it, right? It's unseen. So lots of people might be having it, but they might not know. And other people wouldn't know. So when they approach them or when they talk to them, that other person might have the disorder, and the way they treat them might end up being different because once they see that he's not responding or they're not responding according to what they'd expect them to. Whereas if someone has a physical disorder, you'd be able to see it. And it's oh, okay, so they would know how to deal with them kind of thing.
Physical, I feel like there is a way to cure it. And mental, I don't think it's that easy because it's within the person it's himself. So you might not know how to fix that.
Well, they're both not easy, but mental is more within you and physical is on the outside. So
Well, the biggest difference is mental illness people don't necessarily see, and a physical illness people can tell that something's going on, when a mental illness is easier to hide and might not be noticeable.
Most physical illnesses you can cure, but mental illness is treated, but it never really goes away.
A physical illness is treated more with sympathy, and if you have a mental illness, because you can't really see it, people are oh, they're fine, oh, they're faking it, oh, they're doing it for attention.
I guess that makes sense, yeah. I can't put into words too much how they're different, because in a way that they are the same, but people treat it differently.
Exactly.
If you can see it, they sympathize with you, or you're treated wrong. You're treated wrong because of it. But then a mental illness,
It's
you either can get away with having it, or you can work properly, function in society, but
people don't give you that much
or you're bullied for it.
Yeah.
I think mental illness sometimes is harder to see or recognize. When somebody has a physical limitation, it's obvious. When you have a mental limitation, some people don't know how to even approach you or say or even recognize what you might be going through.
It's part of the same spectrum. The healthy body is in the healthy brain, and the healthy brain is it's just one balance that flows back and forth. You just have to understand this issue.
What would you think or do if you were diagnosed with a mental disorder?
I would probably not want to talk about it to other people because I would want them to think that I'm a strong person. So I would not talk about it to other people. I would just kind of try to deal with it.
I have no idea.
I don't know. Just imagine, hypothetically, if that happens.
I will ask someone to help.
Okay, you will go seek help.
Yeah.
Where would you go seek help?
I don't know.
To get the best treatment as possible. Because it will be something relatively new, and to get the best treatment as possible to overcome the situation, whatever the case may be. So yeah.
Take the proper course of fixing it. If that involved drugs, then
I think I'd have a hard time accepting it, for sure.
I don't know. I'd be surprised. I wouldn't I wouldn't have seen it coming. I don't know. I really don't know.
If I got diagnosed with a mental illness, I'll be pretty. I don't know. I think I'll go into depression, cause Oh, well, I'll be pretty bummed out, cause you never want that to happen to anyone, and especially yourself.
I think if I was diagnosed with a mental illness, I would be grateful for the people who were treating me and helping me and want to make my life better.
Again, I don't think I would be necessarily too worried. I think it can be a common thing to go through. Although it would be tough, like especially if a loved one was diagnosed or if I was diagnosed, it would be tough. And but at the end of the day, you keep going, you keep trying to get through it.
Would you see a mental health professional?
I think I would. I would.
I guess so, yeah. I think I would have to.
Absolutely.
Well, it all depends on, again, treatment. The treatment you get in some institutes may not be the same you get in another. So you got to do research and look for the best treatment.
Find the best doctor to treat you, right?
Where you'll be treated appropriately and not be taken advantage of. Because with mental illness, I believe it's very easy to take advantage of someone where that is concerned. So to do your research and get help, advice on the best path to take.
I would seek help, but I wouldn't seek the guidance of my peers because I would be afraid of what they would think of me.
Why not? I believe I should.
I know what I would do because I have anxiety. So I sought help from a doctor and put me on medication, and things are a lot better.
I had a couple therapists. I had a psychiatrist. I had a psychologist. So I guess those are professionals, but I didn't really like it. I didn't like their ego. I didn't like their ego about it. So.
I mean, I've seen therapists. I don't know if that really counts, but yeah.
So those are pretty diverse answers. We want to first thank everyone who agreed to be interviewed. We know that can be very nerve-wracking. And now let's just talk a little bit about mental disorders. So mental disorders are a wide range of conditions that can affect mood, thinking, and behavior.
There are also various kinds of mental health professionals, such as clinical psychologists that can hold either a PhD or a PsyD. There are also master-level professionals, such as social workers, mental health counselors, and licensed professional counselors.
And then there are also psychiatrists who are medical doctors who specialize in mental illness during residency. They can prescribe medications, and they can also have the option of doing psychotherapy. Although due to the large patient load they usually have, they don't usually have a lot of time with each patient, so that they end up prescribing medications most of the time.
Well, a lot of you guys said that you would seek help from a mental health professional if you or a loved one had a mental illness. At the same time, you recognize that the stigma associated with mental illness is not the same as that associated with a physical illness.
What's going on? Why are you in bed?
Oh my god, I'm in so much pain. Look at my leg. I can't move, I can't do anything, I can't get out of bed.
Oh my god, this looks serious. Are you okay? Do you need help? Do you want me to go take you to the doctor or take notes for you in school? Okay, what's going on? Why are you in bed?
Oh my god, I've been so tired lately and I can't get out of bed. I haven't been eating anything, I haven't been able to sleep, and I've really been trying, but I can't get out of bed.
But I don't understand. You're not sick, right? Do you have the flu or anything or something?
No, but I'm really trying to get out, but I can't get out.
Again, I really understand. You've been lounging around for weeks now, and I think it just seems lazy to me.
So, we hope that you took a little something away from this video. So please feel free to comment below with ideas for our future videos, or if you have any comments or concerns about this video. We will be posting more videos up soon. Please remember to subscribe to our channel. Remember, we're called The Psychoculturalist, and we'll see you soon.
Yeah, so stay tuned.
Bye.
Bye.